Hello everyone, welcome to part 4 of our module. Part 4 is called Creativity in the Clinical Setting. I'm very excited about this particular discussion because I think it's the crux of the whole module, and I think it's very exciting, and it's where we can apply our learning and creativity the most, and where my research and my understanding of creativity and learning applies most, and I think is most foundational. So I hope you enjoy this. And here we go. So for the fun activity to get us started, I've mashed up a video of a differential diagnosis. So this is an interesting YouTube video that some gentleman's made with regards to a differential diagnosis on chest pain, so a chest pain workup. But what I want to do is I want to think about differential diagnosis from the creative lens. So basically what I want to do is I want you to consider these, there's little pop-ups in the video, but besides those, what I'd like you to do is consider your position under differential diagnosis first. So how would you describe the cognitive processes that are happening during a differential diagnosis? 2, the skill set that's required to carry this out effectively. So within the clinical setting, in a dynamic, say, fast-paced emergency room, how you go about carrying this out. Number 3, the clinical setting in which dynamic occurs. We just discussed that. And then number 4, the transition from classroom learning to clinical practice. So when you talk in a classroom, as we discussed in the last lecture, and you want to translate to the clinical setting, so students that are in a classroom and you want them to translate how they do a differential diagnosis in the clinical setting or clinical practice and how difficult that transition can be, I'd like you to think about how you characterize that and what attributes best suit somebody that's able to do this in the different setting. So go ahead, watch the video, pause this video, and then we'll come back when you're done watching the video. Okay, the next thing I'd like to talk about is my personal application of creativity in the clinical setting. So when I think of a great example of how creativity applies in the clinical setting, I think particularly of assessment. So the way that I was taught assessment was a very regimented, list-oriented process where we basically went through memorizing a list of items, and then we had to regurgitate this in a simulated setting. And personally, when I got to the clinical setting, I found it very, very, very difficult to conduct assessments because my preceptors would say, you're taking too long, don't say that list out loud, it's awkward, the patient hears you saying funny things, and I couldn't agree more. The problem is that I learned it initially as a list, and I wasn't able to think creatively because this hadn't been taught to me and this wasn't part of it. And I came to realize, at least as I got better in my clinical encounters, that really I was just using my creative ability to speak and to interact interpersonally with patients to assess them. And that when I reflect back on it, I think how it would have been much more useful to discuss assessment from a creative standpoint. And it would have been much more useful for me to devise would have been able to devise my own list instead of having to memorize someone else's list or some required list. And I think that even having done my own, the same way that you notice in the video that person devised their own acronym or mnemonic, if I had devised my own assessment order, that I think I could have been quicker and more prepared for the clinical setting. So I've put some words up here. I've described assessment as a dynamic and complex component of medical practice. I think we can all agree with that. It's very challenging. The real-life application of a creative process. So this is what I'm trying to convey, is that I think as clinicians get much better, they get more creative, and they get more verbose and creative in the way that they go about eliciting the information that they're required. And then I asked the next question, does analyzing creativity, such as the way that we're discussing it, unravel this magic that we discuss in clinical practice? You know, I had a clinical instructor tell us once that he had a spidey sense, that it was hard to explain what it was, but he got an impression when say, a patient was going to get very sick and possibly die. And I'm wondering, personally, I'm beginning to feel that part of this is how people creatively interact interpersonally. And I think that this does in some respects unravel this magic or this very intangible artistic element of clinical practice. So I think that's interesting, and that just strengthens the importance of creativity. Okay, for readings this week, I have two awesome readings. The first one is great. It's an actual study of junior doctors and their opinions. And the second one by the same author is a challenge of competency-based medical assessments and how they might be leaving out components such as creativity. When you read these readings, I want you to think to yourself first these questions. So how do you expect creativity ratings to relate to ratings of doctors' quality? What is your position on competency-based medical instruction? Do you agree with the critiques of Talbot, particularly in the second article? What is other traits or abilities you think are associated with creativity? All right. So you can pause the document and then go ahead and read it, and we'll come back. All right, so the next thing I want to talk about is my opinion of a well-rounded practitioner. So I put a picture up here of Doogie Howser because I think he's well-rounded. But anyways, I think the well-rounded practitioner manages interprofessional matters professionally or very well. So they're able to think on their feet, which I think is a description of creativity. They're innovative in their problem-solving techniques, as we discussed before. They're dynamic with patients. They find novel solutions to administrative problems. I think that by fostering and selecting for creative applicants or people that can think creatively and coaching them to do so, we're better suiting them to be a well-rounded practitioner. The next thing I have related to this is an application, and I'm applying creativity to common sources of conflict in interprofessional settings. From an article by Brown in 2011, he describes a series of common conflicts that occur in interprofessional settings. So as we know, interprofessionalism is something that's becoming very important within the healthcare setting. And conflicts that occur frequently are perceived incompatibilities between personalities, values, role boundary issues, scope of practice, and accountability. And going back to my well-rounded practitioner, I think someone who's creative, innovative, and thinks well on their feet is able to best manage these different things. Okay, I hope you enjoyed part 4. We have one part left, which is part 5. I hope that I'm beginning to convey to you my passion and interest in creativity, and I hope that it's beginning to set into you that this is definitely an important element of health professions education. Bye for now.